Go ahead, sir.
Thank you. Hello, good evening. I'm Dr. Nilesh Balkawade, Clinical Head and Fertility Specialist, Oasis Fertility, Pune. Here I am with another Facebook Live session for sharing information about starting fertility treatments or what should be the first few steps to take whilst you are considering fertility treatment. Infertility is a problem where 1 in 6 couples in India are facing that, and the problem is increasing day by day because of changing lifestyle, late marriages, uh, problems in the wife, problems in the husband. So all these are leading to an increase or rise in the cases of infertility. When should one start thinking about taking fertility treatment? Is you have completed 1 year of a try for fertility. uh, you have been trying for conceiving and not able to conceive. Once your age is below 35, and if you are above 35 and 6 months you have tried and more than that and you are not able to conceive, in these cases you should seek fertility treatment. Why should you seek treatment so early if you are thinking that it's early? Because this is where 70 to 80% of couples will conceive during this time, and if you are not able to conceive, then there can be some problem, although there may not be some problem, and a few more couples, like around 80% or so, will be able to conceive in the 2 years of their married life or of their try. So if you are having any problem, that needs to be identified. That's why starting to think about taking fertility treatment should be after 1 year of an unsuccessful attempt at fertility. So what is the first step? I think the first step in starting fertility treatments is to be bold and face the problem, know the problem. So you have to be bold. There can be problem with the marital relationship, there can be problem with the sexual relationship, there can be pressure in the married life, there can be pressure from the family, from the in-laws, there can be pressure from the neighborhood and the society. All this will go on, but as a person, as an individual, if you yourself want the baby, and if you are curious about your fertility and you don't know what's the reason of not getting fertile, this is the time where you need to face the problem. When you need to tell yourself that yes, the time is there where you should seek expert help rather than taking help of internet, or rather than taking help of quacks or some advice by neighborhood. It's always better to take a best experienced person's advice, the expert's advice, who will tell you what's the problem, how to identify it, what's the solution of that problem, and other factors related to that solution. All this you can know once you accept and face the problem instead of running away from it. So I think this is the first step in starting fertility treatments. Now, what's the next step? So, next step is to know the problem and accept that problem. How do we come to this conclusion? You will not be able to come to this conclusion on your own many times, and therefore, seeking expert advice is very important. We need not do very like invasive tests for diagnosing. Simple tests such as blood test, sonography, semen test can help you to diagnose what's the problem and to know the problem. So, in 30% of the cases, the problem can be in the wife, 30% of the cases, the problem can be in the husband, 30% of the cases, the problem can be in both, and the remaining 10% may not have any problem, which goes into category of unexplained infertility. So, we can do certain tests and see where the problem is. Is the problem is in the ovaries, in the fallopian tubes, in the uterus, or in the husband side, in the sperm count, motility, or morphology? Once we are able to tell what's the problem, many couples again try to run away from the problem and say, no, no, this cannot happen with us and it's not the problem. You need to accept the problem. That is also important, because once you accept that problem, then you are going to take treatment with that related to that problem. So accepting that problem is very important. A young couple, maybe just turned 30, and the wife is showing block in the fallopian tubes, and the doctors tell you that there's a block in the fallopian tubes, and the treatment is either go to release that block by laparoscopy, or you can go for IVF. And whenever it comes to these procedures, the couple usually go in denial mode, and they say, no, no, this cannot happen with us, and this will not be a problem. Then they keep on shifting the doctors, and here starts the problem where many years are gone, and then they'll end up in few other problems, like the problems with the egg count, problem with the sperm count. This can be there after if they lose those valuable years. So accepting the problem is very important. Once the doctors tell you and you have ample evidence to say, yeah, this is the problem, then we can go and treat that problem, because no problem is so big that it's not untreatable. Now research is gone up to a next level, and we have many solutions available. These solutions can be medical solutions, then there can be surgical solutions, there can be solutions with IVF, there can be solutions with advanced IVF procedures, there can be solutions with uterine transplantation, there are options of surrogacy. So all this basket is available, and mm, only only rarely would be there a couple have such a problem where no option is available. I feel that it's almost all of the patients where the treatment is possible. Only thing is that this acceptance of the problem is very important, so that you don't lose those valuable years of yours, you don't increase your stress, you don't have problems later on with your egg and sperm count. So all this is very, very important. The next step in starting fertility treatments is know the best possible treatment for that problem. So understanding this is very important. As I told, as I discussed, there can be problems at different levels. There can be problems with the wife, there can be problems with the husband. But understanding these problems and knowing the best solution for this problem is also very important. You, you can ask your treating doctor about the problem you are having and the solution to it. There can be options of treatment in that solution, so there will not be a single best treatment. Sometimes there will be options, sometimes there will be options such as medical treatment or IUI or IVF. So multiple options are available. You get the critical analysis of this done yourself, find it out from the doctor which treatment is the best treatment for you, and what is the rationale of starting a treatment. This is very, very important. Once the patient comes to me, this is the first step which I do, is to diagnose the problem and then to tell the patient what's the next best step they can take and next best possible treatment. This depends upon the time duration where we want to achieve the results, the success rate of that procedure, and the cost involved. All these three factors, along with the duration of infertility, will define which type of treatment would be best suitable for the couple. So whichever treatment is being advised to you by the doctor, you need to ask the doctor, or you need to discuss with the doctor about three important things. And one is the time duration which will be taken for this procedure to achieve success. Second would be the success rate of that procedure or the treatment strategy. And the third would be the cost of the treatment involved. All these three things will guide you in taking your decisions. So these are the important treatments, these are the important aspects of starting fertility treatments. I didn't go into theory much this time, but this decision making is so, so important sometimes, because as we all know that there can be episodes of depression, there can be anxiety, there can be sorrow, all associated while taking this fertility treatment, and therefore your decision making power can be hampered. So it's always very important to discuss it out with the best person. So friends, don't try to hide your problems, face them, be very bold facing them. Then know your problem and accept that problem. This is the second important step. And importantly, the third important thing is knowing the best possible treatment or the treatment options which are available to both of you, that as a couple, so that you can take the best possible treatment in the best possible time with the best success. So That's the thing from me right now about starting fertility treatments. Three important steps. Don't miss out on that. I would be happy to take if there are any questions now. Yeah. So, what's the first step in fertility treatment? As I said, be very bold to face the problem, accept that you are having issues to conceive, and take expert advice. That's the first step in starting fertility treatment. How do I prepare my body for fertility treatment? Yes, fertility treatment will include not only medical or surgical line of therapy or injectable therapy, but it will also include lifestyle measures such as having a good diet, have following a good exercise pattern, taking adequate rest, and staying away from addiction. So all these four things are important when it comes to preparing your body for fertility treatment. All this individually we have covered in different Facebook lives, how your diet should be, how your exercise should be, how much sleep you should take, and how addictions can cause problems in your fertility treatment. So you can refer to our previous FB lives. This is how we prepare our body for fertility treatment. What's the first step in testing? So a single stop solution is available at Oasis Fertility Pune, where on a single day we do few tests of husband, we do few tests of the wife, and these are very simple tests, can be done in an hour's time, and the reports can be available the same day, where you will be able to know what's the basic problem. So the first step in testing is basically testing for the husband for semen analysis and few blood tests, and for the wife for few hormone testing and baseline sonography or transvaginal sonography. So these are very important tests in diagnosis. Yeah. So there is a question from the audience regarding the question is not very clear that Sangeeta is asking 6%. Maybe she's asking about success rate of IVF. I would take it that way. So the success rate of IVF depends from patient to patient. We can have a very good success rate if we are able to prepare a very good embryos and with a nice endometrium. The success rates can be very high. Once we are having advanced IVF techniques such as ICSI or laser assisted hatching or blastocyst culture, embryo freezing, pre-implantation genetic testing, microfluidics, max for sperm selection, all this is going to increase our success rate. And I'm not commenting about the exact success, but yes, the success rates are going to be very high if we follow a methodical approach, a patient friendly approach for IVF. So that's the answer of your question. Thank you. If you have any fertility related queries or if you have any questions related to when to start fertility treatment, you can contact us on our helpline. Our number is displayed below, or you can visit us physically at any of our Oasis centers in Pune. We are placed at Wakad at Dynasty Commercial or Arisa Avenue near World Trade Center at Kharadi. So that's for now. I'm Dr. Nilesh Balkawade signing off. Thank you so much.